In April 1999, the US Centers for Disease Control published its quote, 10 Great Public Health Achievements, United States, 1900 to 1999. They made the fantastic claim that since 1900, the average lifespan of persons in the United States has lengthened by greater than 30 years. 25 years of this gain are attributable to advances in public health. This is indeed a truly remarkable claim that has often been reported in various forms by establishment sources and their supporters. However, did public health really achieve any such thing, or is it a case of putting lipstick on a pig? The truth of what they tried to do here is one for the books, and in this video, I'll explain why. When we examine the CDC's claim that since 1900, the average lifespan of persons in the United States has lengthened by greater than 30 years, 25 years of this gain are attributable to advances in public health, it can be seen that there is a citation. This is a 1994 paper published in the Milbank Quarterly with the title, Improving Health, Measuring Effects of Medical Care. This paper opens with the line, within the century, average life expectancy has increased from approximately 45 to 75 years for citizens of industrial countries, an improvement assumed by many to be largely the result of advances in the content and distribution of medical care. So that is where the extra 30 years of life is first mentioned. However, note that the word assumed was used, and to be fair to these authors, they approached such a claim with skepticism despite their acceptance of some flawed mainstream premises. They wrote that the causes of increased longevity are several, including improvements in nutrition, housing, sanitation, occupational hazards, and lifestyle, in addition to medical care. We should observe that these authors are referring to medical care and not public health as per the CDC. Obviously the terms are not synonymous, and this is a sloppy piece of work by the CDC, as citations should be precise and quote exactly what the source stated. It makes you wonder who was involved in this kind of script writing.
He's actually at the door right now.
There he is. Oh my gosh. Was that...
The 1994 paper concludes that the effects of medical preventive measures on life expectancy was roughly 18 to 19 months, and that of medical curative measures was roughly 44 to 45 months. Clearly, this is not the 25 years that the CDC claimed when citing this paper. In fact, the only 25 years that is mentioned is in the sentence, "Our best estimate is that diabetics gain on average 25 years of additional life from medical care, and that the population as a whole gains 6 months of life expectancy." In other words, it is only a tiny fraction of the population that has had any significant increase in longevity due to medical care. In this case, type 1 diabetes was once a virtual death sentence that resulted in the loss of young victims. However, pharmaceutical insulin was and still is a life-saving remedy, so this is one of the few chronic conditions that mainstream medicine has truly helped with, at least until a real cure is found. Coming back to the CDC's claim that 25 years of this gain are attributable to advances in public health, it is thus unclear why they cited this paper, which focuses on medical care and its conclusion of fairly minor contributions to life expectancy at a population level. Before we move on from this paper, it should be pointed out that even these minor contributions are overblown, as they assume there are significant benefits from antibiotics and vaccines, the latter of which I will expand on soon. And here in the study, they make the preposterous claim that drugs and electroconvulsive therapy have contributed towards a, quote, 70 to 80% relief rate in patients with depression. In case you are wondering whether there is any evidence that the allopathic medical complex has any overall benefit to our communities, I have covered this in my video, The Healthcare System Hoax. You can also watch my top 10 reasons to be a struck-off doctor for my account of why I was happy to depart the ranks of the fraudulent medical establishment. Now we come back to the CDC's much vaunted 10 great public health achievements extravaganza, with the knowledge that even their first sentence was highly misleading. The 10 apparent achievements are listed, and we are informed that the choices for topics for this list were based on the opportunity for prevention and the impact on death, illness, and disability in the United States, and are not ranked by order of importance. Number 1. Vaccination. The CDC provides us with Table 2, which is alleged to contain evidence for the beneficial effects of many vaccines. In Column 2 is listed the baseline 20th century annual morbidity for 10 conditions. In Column 3 is the 1998 provisional morbidity for the conditions, and the last column indicates the percentage decrease over the century. Well, stone the crows. Morbidity went down close to 100% for each of those conditions, and there were vaccines for all of those diseases, so it's a slam dunk, right? No. First, we observe the exact language used by the CDC, which is dramatic declines in morbidity have been reported for the 9 vaccine-preventable diseases for which vaccination was universally recommended for use in children before 1990. That does not actually mean that vaccines had anything to do with the drastic reductions in morbidity. We can see from these dissolving illusions charts that the incidence of most of these diseases had fallen into insignificance by the early and mid-1900s, that is, prior to the widespread introduction of key vaccines. Jordan Henderson has produced similar examples, such as this chart, which clearly shows that diphtheria notifications in the United States had fallen dramatically by the time the vaccine was introduced to the wider population in the 1940s. Just as importantly, the mortality rates for these diseases had also fallen into virtual insignificance by the time vaccines were introduced. For example, the measles death rate in the United States had dropped to almost zero when the vaccine was introduced in 1963. This is a topic we have certainly covered before and can categorically say that on foundation science, vaccines will not offer any health benefits. Number 2, motor vehicle safety. This is a dubious inclusion because motor vehicle safety depends significantly on market issues, such as what the consumer is prepared to spend and what the manufacturers can commercially provide at the time. If you want a safer car, then you pay a bit extra for brands such as Volvo and Lexus. The major problem with road traffic injuries and fatalities comes from government monopolised roads, and there is no evidence that their, quote, service benefits our health at all. By all accounts, large numbers of people are still dying on the roads, despite vastly improved car standards, so claiming public health measures are a factor is disingenuous. Number 3, safer workplaces. Again, this is an area where governments claim that they improved the landscape, and yet, were they not in charge when workplaces were far less favourable? The CDC state that severe injuries and deaths related to mining, manufacturing, construction and transportation also have decreased. Since 1980, safer workplaces have resulted in a reduction of approximately 40% in the rate of fatal occupational injuries. Many occupational hazards were not initially recognised, or at least quantified, and we don't need public health agencies to let us know several decades later. Despite the mainstream propaganda, most businesses do not want bad outcomes for their workers. At the time, what seemed like good equipment and safe practices now looks diabolical to us. Number 4, control of infectious diseases. We have already seen their bogus claim that vaccines increased lifespans. So what are they on about here? They state infections such as typhoid and cholera transmitted by contaminated water, a major cause of illness and death early in the 20th century, have been reduced dramatically by improved sanitation. We have covered this topic many times, including in our book, The Final Pandemic, where we explain that it is not germs that make people sick, but the toxic compounds that have contaminated the water. For more on this topic in general, you can watch my presentations such as Why Pathogens Don't Exist. The CDC go on to claim that the discovery of antimicrobial therapy has been critical to successful public health efforts to control infections such as tuberculosis and sexually transmitted diseases, STDs. If that is the case, shouldn't there be plenty of scientific studies that could be cited? Antibiotics are not life-saving drugs, and you can find out more about this in my video, The Truth About Antibiotics. Number 5. Decline in deaths from coronary heart disease and stroke. This seems to be their idea of perverse satire. As reported in the American Journal of Medicine, heart disease was an uncommon cause of death in the US at the beginning of the 20th century. By mid-century, it had become the commonest cause. Let's have a look at the official chart depicting the death rates over the previous century. That's right, the problem appeared and became the leading cause of death before going down, but has remained a major problem. The CDC's quote, decline in deaths is thus misleading. So what can we say to them?
You just don't get it, do you? You don't.
Number 6, safer and healthier foods. Apparently this is due to decreases in microbial contamination and increases in nutritional content.
What a joke!
It should read better food handling and storage technologies, rather than blaming microbes for reacting appropriately to the terrain. And the CDC's claimed increases in nutritional content is quite a stretch, as crops have mainly been bred for quantity rather than quality, while subsequent industrial processing has completed the nutritional bankruptcy. It has left a population with excess calories and low nutrients. The CDC claim that food fortification programs have almost eliminated major nutritional deficiency diseases. But this fails to see that our food should not need doctoring in the first place. You can watch my video on folic acid to see why these so-called fortification programs do not work. Number 7. Healthier mothers and babies. Once again, we see some conflation and misrepresentation of the factors at work. For example, better hygiene is correct, but availability of antibiotics in the same sentence is not. You can watch my video, Health Risks of Using Your Cell Phone, where I discuss the story of obstetrician Ignaz Semmelweis and the reason that hand washing is effective, but not because of germs. And yes, infant mortality decreased greatly last century, but mostly through vastly improved standards of living, not because of, quote, technologic advances in maternal and neonatal medicine. On that apparent achievement, Ruth Lokshin, the daughter of Dr. Robert Mendelsohn, remarked, "An obstetrician is like a fireman. They both rush in and save lives. The only difference is the fireman didn't start the fire." Number 8. Family planning and contraceptive services. While that may appeal to the population control cult, these, quote, services do not lead to healthy families. In fact, often they lead to no family at all. Women were not liberated by contraception last century, as mainstream propaganda portrays. Instead, it left a train wreck of despondent females who lost connection with themselves and the ability to be treasured wives and mothers. For the icing on the cake, the CDC go on to claim that barrier contraceptives prevent pregnancy and transmission of human immunodeficiency virus and other STDs. Yes, barriers will prevent pregnancy, as that is a sexually acquired condition. But no, STDs are not, as claimed, transmitted through, quote, germs. If that surprises you, then please watch our publications on this topic. And I would also recommend Dawn Lester's short article, There's No Such Thing as a Sexually Transmitted Disease, for an overview. Number 9. Fluoridation of drinking water. What better way for synthetic fertilizer corporations to get rid of a toxic chemical byproduct and sell it to municipal governments as a purported health product? Like the heart disease example, this is another man-made problem as dental caries increased from the late 1800s and became significantly worse up to the 1960s. Are we supposed to believe that a fluoride deficiency was to blame? Anyone who has investigated fluoride makes sure that it is not in their toothpaste and certainly not in their water.
Does the NSF have a position on what the upper tolerable daily dose of fluoride that will not cause neurotoxic effects is?
Since we have not conducted risk assessments on any of the fluoridation chemicals, we do not have a position on the daily dose that would be appropriate to prevent or to reduce the risk for neurotoxic effects from fluoride exposure.
For more on this topic, you can watch my 2022 interview with Kane Titchener of Fluoride Free New Zealand. Number 10. Recognition of tobacco use as a health hazard. Well, many people had worked this out for themselves and didn't need to wait for the Surgeon General's 1964 report on the subject. Furthermore, the decision to purchase and use cigarettes is up to the individual. I've never met anyone who referred to it as a health measure. There is also a difference between big tobacco cigarettes full of chemicals and designed to be as addictive as possible versus the various leaves that have been smoked by almost every culture over thousands of years. Like most cancers, the incidence of lung cancer was rare and then increased dramatically after 1900. Perhaps the only useful public health measures was the control of secondhand smoke in public areas. However, for us libertarians, it is clear that government control of these zones is what creates the problem in the first place, like the wider environmental pollution disaster. So there you have it. The CDC's claimed 10 great public health achievements from 1900 to 1999. Overall, nothing great about any of it. As we outlined in our book, Virus Mania, most public health institutions simply manufacture misleading narratives to create an aura of legitimacy and necessity. The typical story involves how terrible everything was until their miraculous inventions and interventions saved our lives. That is their way to ensure ongoing funding, prestige, and power. As we saw during the COVID-19 event, so-called public health has been weaponized against populations with fear-based campaigns to ensure greater control. The good news is that increasing numbers of people have lost all trust in public, quote, health institutions and are seeing straight through the lies. No one can take care of your health better than you, and I encourage everyone to consider what you can do as an individual to improve yourself, your family, and your community. There is no need to look to the false god that is public health. For more information on all of these topics and how to achieve true health, we provide hundreds of free resources at drsambailey.com. If you enjoyed this video, please visit supportdrsam.com.